Good morning, and thank you so much for joining us. I'm Michael Curran from the Ottawa Business Journal. On behalf of Mayor Jim Watson, the Ottawa Board of Trade, and OBJ, welcome to the Mayor's Breakfast for February 2022. The Mayor's Breakfast is co-produced about 8 or 9 times a year by the Ottawa Board of Trade, OBJ, in partnership with Mayor Jim Watson. Normally, the Mayor's Breakfast takes place at City Hall, where we have lots of energetic networking and an expansive hot buffet. Today, we come to you once again in a virtual format, broadcasting across many social media channels, including YouTube, LinkedIn, and Facebook. The good news is we hope to be back in person at City Hall in March, so keep your fingers crossed on that front. Since we last gathered for the Mayor's Breakfast on Friday, January 21st, much has transpired in our city and our province. An occupation of Ottawa's downtown core by protesters has just ended. And notably, given our guest speaker today, the province of Ontario has significantly changed its perspective on pandemic restrictions. So today's guest is a timely one for sure. We have Dr. Adam Kassam, President of the Ontario Medical Association, with us. Do not miss that presentation coming up in about 10 minutes. Also coming up, my interview with the President and CEO of the Ottawa Board of Trade, Su-Ling Ching. And of course, Mayor Jim Watson will join us in just a few minutes from City Hall with his update. Anxious to hear that. As we kick off the show, let's recognize some of the great organizations that support this speaker series. Our lead sponsor is Hydro Ottawa, also RBC, the Commissionaires Ottawa, Algonquin College, Rogers Communications, the Westin Ottawa, Enbridge, our global event partner, Oakwood Designers and Builders, our food sponsor, La Cité, and our speaker gift sponsor, Eamon Harnden LLP, and our coffee sponsor, Capital Office Interiors and Steelcase. A big thank you to all of those sponsors. Now let's welcome OBJ's partner in producing this event. Here is the President and CEO of the Ottawa Board of Trade. Please welcome Su-Ling Ching. Good morning, Su-Ling.
Good morning, Michael.
How are you doing today?
I'm doing just fine today.
It's been a busy few weeks for sure.
Absolutely.
So let's start off with talking about an issue that I think is on everyone's mind, Su-Ling, and that's, of course, the occupation of downtown Ottawa that lasted for 3 weeks. What's your perspective from the Ottawa Board of Trade?
Well, it was very, very challenging, of course, for our community from many different prospects. Number one, for us, the businesses that were directly impacted by the occupation, some of them having to close completely, some of them having a significantly reduced business. I've heard reports anywhere from 50 to 100% loss of revenue from those businesses. And, a general anxiety from the customers and their employees to be able to get to their business. So we have called on every level of government to help support those businesses as we come out of this. We're happy to have heard from the federal government. They have a plan in place that will be executed over the next few weeks. Of course, the city put together a business support package, and they don't have as much leverage as the other levels of government, but they put together a really innovative package. And we're still waiting to hear from the province to support those businesses. But in general terms, the focus is rebuilding the business, consumer, and employee confidence in the downtown core, which is so integral to our overall economic landscape.
And let's just spend a second on, so you talked quite properly about how governments can help, but consumers can help, right? The Board of Trade has been advocating for this during the pandemic, so consumers are certainly part of the solution here.
I would also say, Michael, it's the most powerful part of our solution, to be frank. Like, we have engaged in several buy local programs over the course of the pandemic as a way to have everyone be involved in the recovery. But if that's definitely a focus that we would look at right now. And we've extended our buy local campaign as well.
So let's talk about the pandemic. Of course, the protest was going on in the context of already what could be deemed a crisis, but lots has changed since we last spoke at the mayor's breakfast. As I indicated a few minutes ago, the province has lifted many restrictions. What is your ask from either provincial or local health officials,
Mhm.
Suling?
Yeah, so I think that creates a sense of optimism for sure. We have always followed the lead of our scientific advisors and experts. That's what we follow. We have called, though, on every level of government to be very transparent about where the decision making is coming from, that it's evidence based, that it's clearly communicated, and that they have a plan that all of us, but particularly businesses, can use to plan for their businesses as well. So we continue to advocate for that, but definitely we've just done a member survey, and in general terms, people are optimistic about the economic future. We do call on every level of government and across all parties to work collaboratively to get together to address our recovery. And so we continue to support that. And we continue to ask for support for the hardest hit sectors as we look to our economic growth.
For sure. And Suling, just before we bring in the mayor, let's
Mhm.
spend a second talking about the Welch LLP Ottawa Business Growth Survey, which is an
Mm.
annual survey that we do with Welch and the Board of Trade and OBJ. And we've
Mhm.
got Abacus Data doing the research, and it's a big major survey, the big one of the year, in my opinion, where we
Mhm.
try to get all sorts of data. We're meeting with BIAs and business associations this afternoon and launching the survey in the next few hours. Any comments as we head into that research period?
I compliment your leadership, the Board of Trade and Welch for doing this is this the eighth year? Eighth
I
year
I think
that
it
we've
is,
been doing
yeah.
this. And, during the last 2 years, data-based decision-making has been the number one thing on our minds at every level of government. And I can tell you that the Ontario and the Canadian Chambers of Commerce have all also put this high on their priority list. As part of our new strategic plan, we have committed to database decision-making and calling on governments to do that. And so we're really ahead of the game with this Ottawa Business Survey. So I really encourage leaders of the business community to get involved in putting this forward. We use this data in our planning for economic growth and our advocacy work for at the other levels of government. And so it's an important part of our plan moving forward.
Absolutely. And this maybe I'll just touch on two key components. So the one
Mhm.
component is what we call the Business Confidence Index. So there's about
Yep.
10 questions that are repeated over that 8-year period to measure the level of confidence of local business people when it comes to things like revenue growth,
Mhm.
profitability, hiring intention, so on and so forth. But then there's lots of topical questions. So we're asking, of course, pandemic questions,
Mhm.
return to office questions, all sorts of things. So it's interesting. It does take about, I'd say, 10 to 12 minutes. So business leaders will have to set a little bit of a time aside, but it's well worth it, I think, Suling.
I think so too, and I've really started to hear from business leaders that there's a deeper understanding perhaps of how important it is that we know what's going on and that we're working together to make change in our own community.
Yeah, for sure. Well,
Mhm.
thanks, Suling, for joining us this morning. Keep up the good work, and all the best to the Ottawa Board of Trade and your directors and members as we, get to a bit more normalcy.
Thank you, Michael.
As we transition to Mayor Jim Watson and our keynote speakers, a note that you can use the comment function on your platform to ask questions. So I'll be looking for those questions as Dr. Kassam speaks. Now it's time to welcome our host, His Worship Mayor Jim Watson, for his update from Ottawa City Hall. Welcome, Mr. Mayor.
Well, thank you, Michael and Suling, and good morning, ladies and gentlemen. Bonjour, mesdames et messieurs, and welcome to the Mayor's Breakfast, and particular welcome to Dr. Adam Kassam, President of the Ontario Medical Association. I want to begin by acknowledging that Ottawa is built on the unceded territory of the Anishinaabe Algonquin Nation, et les peuples de la nation algonquin habitent ce territoire depuis des millénaires et continuent aujourd'hui de l'enrichir par leur culture et leur présence. And the city of Ottawa honors its First Nations people, the Anishinaabe Algonquin Nation, as well as the Inuit and Métis leaders for their great contributions to our city and our country. I also want to thank the Board of Trade and Sue Ling and her great team, and the OBJ and Michael and his team for their continued support to business communities during these very difficult times. The city has endured a traumatic occupation that has shaken the public's trust in our institutions, and City Council must work together to regain that lost trust and move forward with effective governance that puts the residents and businesses of Ottawa first. After a long and challenging 4 weeks, Ottawa's downtown is in the process of returning to normal following the police operation of last weekend. And I commend Chief Bell and the women and men in uniform. They conducted with precision, restraint, and professionalism an operation to free the city of the occupied truckers and their vehicles, and a lot of garbage that was left behind. And I commend those officers from not just Ottawa Police Service, but across the country that came to our need when we asked for their support. The good news is that downtown Ottawa businesses are reopening this week as the police begin to move checkpoints and the cleanup continues. Yesterday at City Council, we put forward a package of measures to support downtown businesses that were most affected by the occupation. And I want to thank Sue Ling. The Board of Trade, of course, was very instrumental in making sure that we got the wording right on the motions and got the concept right to do whatever we can with our limited resources, because as you know, we can't bonus or directly subsidize a business, but we can help through the BIAs and so on. So we still have a long way to go in our recovery, but we're taking important steps to support business and revitalize our city after the siege. I want to thank Mathieu Gravel, who worked really hard on all of the motions and got members of council to support them. The motions included a property tax deferral program for businesses in the impacted areas, as well as funding for the most impacted BIAs to market and promote their destinations. We're also working to support the Ottawa Music Industry Coalition to offer local musical performances in the impacted neighborhoods. And we introduced an expansion of the no fare transit service that will include all routes that bring customers to and from the affected areas, as well as 1 month of no charge parking at city lots and garages in the impacted areas. And we remain committed to working with all our economic development partners and small businesses to help them through this critical time. People may be hesitant to visit downtown neighborhoods, but residents can easily access businesses and restaurants in these areas. I encourage your continued online and in-person support. Of course, we're still in the midst of a global pandemic. The last thing we needed was the occupation, but we're fighting the good fight against the pandemic, and we need to continue to follow our public health guidelines. I'm very pleased to have Dr. Kassam here to discuss the OMA's roadmap to fixing our healthcare system, a new comprehensive model of care that supports a strong economy. I also want to take this opportunity to thank our public health professionals under the leadership of Dr. Vera Etches and everyone who's been working very, very hard to keep our community safe during the pandemic. I always boast about this, Doctor, that we have the best vaccination rate of any big city in Canada, something we're really proud of here in Ottawa. On behalf of all the residents, I extend my heartfelt thanks to the healthcare sector for their ongoing work to battle COVID-19 in these very unprecedented times. These dedicated professionals remain the unsung heroes in our community, and we're truly grateful for their work, which continues every day. In closing, I want to add that we have seen remarkable people and organizations that have continued to reach out and help the most vulnerable in our community during some of the darkest days. I want to thank them for showing compassion and kindness and for reminding us of our humanity in the face of some atrocious behavior that we've witnessed in the last 4 weeks. Now, it's now my pleasure to introduce Dr. Adam Kassam, President of the Ontario Medical Association, or the OMA. The OMA represents the political, clinical, and economic interests of Ontario's physicians and advocates for the health of Ontarians in the transformation of the province's healthcare system. Dr. Kassam has a passion for bringing people together, engaging in meaningful discussions and making a difference. He was born and raised in Toronto, where he now practices as a community-based not sure what that is, a physician, I guess it's supposed to be. Dr. Kassam is dedicated to sharing his knowledge of public health, diversity, and equity with the medical community and the public, as well as his expertise in research and education. He completed his undergrad studies at Cornell University and earned his medical degree at Dartmouth Medical School, where he concurrently graduated with a master's in public health from Columbia University. He then completed his residency at Western University, where he served as chief resident in the Department of Physical Medicine and Rehabilitation and became involved in the OMA as a voting delegate. As president of the OMA, Dr. Kassam recently shared recommendations for clearing a backlog of 21 million healthcare services in Ontario that have built up during the pandemic. And even before the pandemic, patients were waiting a significant amount of time for their treatments, and unfortunately, it might take months, if not years, to clear this backlog. That's why the OMA is proposing a new comprehensive model of care that includes the creation of integrated ambulatory centers to provide surgeries and procedures that can be done safely on an outpatient basis. It's my pleasure to welcome our esteemed guest speaker, and again, my thanks to everyone for being here today. Dr. Kassam, the floor is yours.
Well, thank you so much, Mayor Watson, for the kind introduction and for inviting me to attend this meeting of the Ottawa Board of Trade. And let me first acknowledge the challenges that Ottawans have faced in recent weeks. And let me also express my solidarity with members of our Ukrainian community here in Canada and around the world. And as part of the OMA, it's an honor to be here to represent Ontario's 43,000 doctors. To begin, I want to convey our gratitude for the immense efforts and sacrifices made by the business community throughout the pandemic to keeping our province running, and for this incredible support that you have demonstrated to all frontline healthcare workers. You'll never know how much that support has meant to each and every one of us in business, and small business is the lifeblood of our economy. We are now verging on the third year of the pandemic that was expected to last a few weeks. And the stresses of COVID have exposed the gaps in our healthcare system that doctors, nurses, and other healthcare professionals have been speaking up about for decades. And like most Ontarians, many of you and your family members, friends, or even colleagues are likely personally experiencing these gaps. Last summer, the OMA launched a province-wide public health survey at betterhealthcare.ca to gauge Ontarians' perceptions of the healthcare system at the local and regional levels. 60% of Ottawa residents who responded to the survey agree that the way healthcare is delivered has become worse as a result of the pandemic. 48.7% gave the city's healthcare system a C grade, while 22.5% gave it a failing grade. These sentiments are similar to those residents from some 600 communities across the province who responded to our survey. The depths to which Ontarians are expressing their concern reemphasizes the OMA's contention that patch jobs and patchwork to our healthcare system just aren't good enough anymore. So here's a couple of interesting statistics. As of December 2021, as you were just saying, Mayor, there have been over 21 million medical services delayed because of the pandemic. 21 million. That's more than one delayed medical service for every single Ontarian. And this pandemic backlog includes not only the surgeries and procedures often that dominate the news, and we'll talk a little bit about that, but it also includes all types of preventative care such as well baby visits and routine childhood vaccinations, elder care, cancer screenings like mammograms and colonoscopies, MRIs, regular monitoring of patients living with diabetes or other chronic diseases, and all manner of follow-up visits with family physicians and specialists alike. And tragically, this delayed care is leading to patients being sicker than they ought to be. This is not only putting more mental and physical stressors on the patients and their families, but in turn puts more actual and fiscal demands on the healthcare system. However, even after COVID has passed and we're getting close to that point, hopefully, at least here in Canada and at least endemically, after years of physicians working well above capacity just to catch up on the pandemic backlog, simply returning to the same old, inefficient, unconnected system burdened with wait times is frankly unacceptable. Sick patients can't wait. And so we must also think about how we think about the future. And so future-proofing our healthcare system is a key priority, not because it's a matter of if the next public health emergency will happen, but when it will happen. And Dr. Etches, who has been a leader in the Ottawa community and right across the province, her and her colleagues will tell us that we have to be better prepared for the next one. The pandemic has also demonstrated what you as business leaders already know. A robust and sustainable economy requires a robust and sustainable public health system. They're inseparable. Responding to the pandemic has placed an unprecedented and unsustainable burden on local business communities and local governments. In the meantime, other critical services still must remain operational. And of course, municipalities can't run a deficit. The alternative is raising municipal taxes, putting an added stress on ratepayers, your businesses, too many of whom are barely getting by as it is. And Ontario is fortunate to have some of the most talented physicians, nurses, and other healthcare professionals in the world. As a province, we have the financial means to properly fund a healthcare system that should be more than adequate. It can be excellent. And I'd like to highlight some of the concerns that physicians see, major issues that need to be addressed. We don't have enough doctors. We don't have enough other healthcare professionals and other frontline health professionals where and when we need them. At least 1 million Ontarians don't have a family doctor. I mean, that's almost 1 in 10 of those folks live here in Ottawa. Over 95,000 Ottawa residents are not attached or unattached to a family doctor, as reported by the Ontario Community Health Profiles Partnership. And over a third of those aged 19 to 34 don't have a family doctor. A quarter of those aged 35 to 49 don't have a family doctor. So it's not surprising then when Ottawa residents in the betterhealthcares.ca survey were asked their number one healthcare issue aside from COVID was more doctors. And that ranked second at 21.3%, surpassed only by wait times at 28.5%. And those two things are linked. This large number of unattached patients is extremely worrying. Family doctors provide preventative care, help patients manage chronic conditions, which reduces hospitalizations, and are the gateway to the rest of the healthcare system, including referrals to specialists or other care providers as required. And while we know that the team-based care approach produces the best results for patients, physicians right now aren't permitted to practice in the model of care that would actually help to better the care of their patients. And even before the pandemic, doctors, nurses, and other frontline healthcare workers were burning out. When that happens, it impedes access to care for everyone. In fact, a study published by the Canadian Journal of Emergency Medicine in June found that 86% of Canadian emergency physicians, of course, these are key frontline workers during the pandemic, met the criteria for burnout. Burnout is primarily caused by system issues. So this is another imperative to fix the system as we think about the future. Compounding the strain on physicians is the precious time that we waste all day long, each and every day. We're dealing with things like faxes. Faxes. And in the 21st century, when there's an app for everything, we can fly a helicopter on Mars in real time, and we're seeing some of the geopolitical things that are happening right now in the world that are a lot of which is guided by technology. The patient records platform used by doctors, pharmacies, hospitals, and labs don't all talk to each other at the same time. So that 88% of physicians are forced to use fax technology to share patient information. In fact, I get referrals by fax on a daily basis. If each of these physicians, our physicians, the over 43,000 physicians across the province, could divert just 1 hour a day from the administrative burden caused by faxes and other areas of technology, including electronic medical records, for example. So if each one of these physicians could divert just 1 hour a day from that administrative burden to direct patient care, 1 million more Ontarians could be seen every month. That would help with wait times. So better and more timely information sharing would streamline the system and preserve precious resources by reducing the need to duplicate tests. I'm a physiatrist. I know Mayor Watson, you had trouble with the word earlier. No one knows what a physiatrist is. And I joke that I'm the first physiotherapist to lead the Ontario Medical Association, but I'm a physician that deals with chronic muscle, bone, and nerve injuries. So folks that will come into Bruyere, for example, for rehab after a stroke, those are the types of folks that I see and help to take care of. And so I work in a rehabilitation hospital where many of my patients are transferred after surgery or trauma or an illness or disease. And our platforms at our hospital, for example, often can't link to other platforms from other hospitals where we receive patients. And so our ability to understand what is happening in real time or what happened at other hospitals or other settings is actually not completely in sync. And this is problematic because it's frustrating not to know what has happened at another institution or at another clinic, and ultimately then provide the best possible care in real time. So that's sort of the digital infrastructure that we talk about at a broad level. We also don't have enough home care to meet the needs. So all of those patients that come into my rehab hospital after they've had their surgery, they have to go somewhere after their rehab stay. They either have to go home, which is where we would want them to go, but being able to support that kind of robust system is currently not in place. So when I say home care, many people first think about frail seniors who could use more daily help. Of course, that's true, but home care is also much more than that and a very important part of the continuum of care. Home care serves people of all ages and all ranges of need, from elder and memory care to monitoring post-surgical recovery or providing wound care or assisting children and adults living with a disability. And of course, COVID has shown that we need to preserve a strong local public health system, because when we don't have capacity in our healthcare system to ramp up or scale up immediately or aggressively, then everything downstream and upstream actually is impacted. And so in addition to combating pandemics and other public health emergencies, a strong public health system led by specialty trained public health doctors like Dr. Etches preserves health and prevents illness every single day. And local public health units track cases of more than 60 communicable diseases. We have to remember, we've been in an environment of the past 2 years of thinking and focusing almost exclusively on COVID, but there's also non-COVID care that has to get done, that has to be addressed. So, local public health units in many circumstances, and you know this very well, Mayor, serve that need. And so, for example, things like inspecting restaurants for health hazards as we think about a reopening, ensuring the safety of private wells in rural areas, promoting health in disadvantaged communities, leading routine vaccinations. And I'm proud that Ottawa is a nationwide leader in terms of big cities for vaccination. It's great. Operating supervised consumption sites and responding to complaints of retailers selling tobacco or cannabis to children. This is the gamut that public health runs in our communities every single day. So especially now, under the shadow of the pandemic, whose effects on healthcare will surely reverberate for decades to come, we can no longer afford not to make the necessary foundational changes to Ontario's healthcare system. There's really no road left to kick the can down. And that's why in October of last year, the OMA released our Prescription for Ontario's Doctors 5-Point Plan for Better Healthcare. It's a carefully considered and integrated roadmap to repair and strengthen our healthcare system for the long term. And we know that the provincial election is on June 2nd, and the OMA is calling on all political parties in a nonpartisan approach to adopt our recommendations for implementation over the next 4 years. Because regardless of which party wins the election, every Ontarian deserves better healthcare. And to inform our Prescription for Ontario, the OMA conducted the largest consultation in our 140-year history. Over 8 months, 1,600 physicians representing all specialties and regions and 110 stakeholder organizations working in or linked to the healthcare system provided their input. We also drew the feedback from 8,000 Ontarians across 600 communities who responded to the survey. And our prescription makes many recommendations, in fact, 87, which seems like a lot. But it includes specific ones for the North, for rural communities, including reducing wait times and backlogs, expanding home and community care, addressing mental health and addiction challenges, strengthening public health and emergency preparedness, and digitally linking every family with a healthcare team. And I'm going to speak about each of these 5 priorities in a little bit more detail shortly. But before I do, I want to share that according to a recent Ipsos survey, 96% of Ontarians fully support these 5 pillars of our plan. That's incredible alignment and tells us that we are on the right track. So the first of these five prescription priorities is to reduce wait times in the backlog of services. This is not a surprise because this is probably the largest challenge facing our profession right now. And this is outside of COVID. This is critical for patients needing a test or treatment, waiting for any type of surgery or procedure, or living with a chronic disease. At the end of December 2021, so late last year, the OMA actually analyzed some data. And our data indicated that just to clear the pandemic backlog, not counting pre-COVID wait times and the physicians working at 120% capacity, which we know is not a sustainable rate, it'll take 22 months for us to get through the backlog of knee replacements, 21 months for cataract surgery, 14 months for hip replacements, and 10 months for cardiac surgery. And that's just the procedure part of things. And these data actually don't include surgeries that were paused due to the Omicron wave. We remember what happened a couple of months ago with Directive 2 to create capacity for Omicron, so that those numbers don't actually account for this most recent shutdown. And these are sort of numbers that keep doctors up at night. In every statistic, we see our individual patients and their families. We see them waiting, we see them worrying and becoming less well as time marches on. And we see your families. But there are solutions to reducing wait times. Earlier this month, the OMA released a comprehensive report recommending the creation of publicly funded integrated ambulatory centers. So these would be freestanding centers which would work in conjunction with local hospitals to provide OHIP-insured medical services, including surgeries and procedures, on an outpatient, same-day basis. This would free up hospital beds and operating rooms, allowing them to focus on more complex, acute, and emergency patients and procedures and reduce those wait times. So the second priority is expanding mental health and addiction services in the community so that professional help is there for all who need it. Where mental health and addiction supports are not provided or supported by other orders of government, the fallout is most keenly felt at the local level. This can manifest in increased calls for services by first responders, a rise in the incidence of domestic violence, increased numbers of people becoming homeless, and pressures on delivery of social services. And this is an acutely municipal situation that is felt by all cities across the province. And there is simply no capacity for municipalities, of course, to do more than they already are doing. which is why we've in our prescription have called for further bolstering and support and investment in local public health units. The third priority is improving and expanding home care and other community-based care. 75% of care that takes place outside of the let me repeat that. 75% of care takes place outside the four walls of a hospital. It happens in the community. It happens down the road and around the block. We need to bolster home care, long-term care, palliative care, and care for chronic disease so that hospital admissions might be avoided and stable patients can leave hospital sooner with more choice about where they receive follow-up care. The same reason why surgeries were paused during COVID is the same reason why we need more community care. You can't perform surgery on a patient who requires a post-surgical bed when all beds are full. This is the concept of ALC. In 2019 and 2020, there were 1.3 million hospital day beds used by ALC or alternate level of care patients, those who are stable enough to leave hospital, but there isn't a long-term care bed, a hospice bed, a rehab bed, or even a home care for them to transfer to. This creates a major bottleneck that increases surgical wait times and leads to hallway medicine. This is essentially healthcare gridlock that we're talking about. And it also doesn't make financial sense. According to the Ontario Hospital Association, it costs approximately $500 a day to provide care for a patient in hospital, $150 a day in long-term care, and even less for home and community care. And so with the current estimated cost of keeping ALC patients in hospital at $650 million a year, the math is clear. Providing care in other more appropriate settings would actually avoid hundreds of millions of dollars in healthcare spending that could be otherwise better invested. The fourth priority is strengthening public health and pandemic preparedness. And I talked a little bit about this earlier on and alluded to sort of public health response. And as I mentioned earlier, this is an area that directly impacts local communities. And to address this pressure, the OMA's recommendations include enhancing local public health so it can be a strong local presence for health promotion and protection, and providing a clear, adequate, and predictable funding model and formula for local public health units that return to the 75% paid by the province and 25% paid by municipalities. To prepare for the next pandemic, the OMA also recommends requiring a provincial legislation for a pandemic plan that includes a mandatory review and update every 5 years to reflect the changes in local public health practices, medical science, and technology. The last and fifth priority is giving every patient a team of healthcare providers and linking them digitally. I talked a little bit about this earlier with my experience in our rehab hospital, but also out in the community amongst clinics, hospitals, and other settings. And the reason why this is so important is that patients can ultimately then receive different types of care that they need faster, and care providers, so the doctors, offices, emergency departments, pharmacies, hospitals, and home and long-term care can actually share information more quickly and more efficiently. I've spoken about healthcare's unfortunate relationship with fax machines. There is work being done, of course, by government to link patient record platforms. However, these efforts should be accelerated. And we can't talk about digital without talking about virtual care. And virtual care, over the past 2 years has actually blossomed in many ways. And we've also come to know that over the past 2 years, that virtual care should, in some respect, become permanent. And the OMA has pushed hard at the beginning of the pandemic to enable more access to virtual care for patients. Because without virtual care, in fact, we talked about this 21 million delayed patient care services, that would be much, much greater without the adoption of virtual care. And there's a long history about why we've gotten to this place right now and sort of the history behind the reasons for some of that delay of adoption of virtual care. The temporary OHIP codes, for example, that were introduced for OHIP services to be funded by government actually expire in September of 2022. Part of the reason why we have not seen a large adoption prior to the pandemic was that it was not funded. And so to ensure all patients continue to benefit from virtual care, the OMA is recommending making permanent the temporary OHIP fee codes for virtual care services provided by phone, video, text, and email. Patients should have access to virtual care for any insured healthcare services that can be appropriately delivered through electronic means. And we understand that we are in an environment where we are still better defining and understanding appropriateness for virtual care. Not everything can be done virtually. I'm a physiatrist and I see patients with knee pain or strokes. If someone has knee pain, I can't tell if that knee pain is because of an ACL tear, tendinitis, is it a sprain, is it garden variety osteoarthritis, is it a bursitis? Hard to do that without doing a physical exam. And so there are limitations on virtual care, but appropriateness is being defined, and that is something that needs to be part of the conversation, as well as part of that the concept of sustainability for the future. So through all the priorities and recommendations, the OMA has been diligent that Prescription for Ontario be built around the principles of access, equity, efficiency, and integration. Because we know that all Ontarians, again, they deserve the best care possible, no matter who they are, what they do, or where they live. And while Prescription for Ontario focuses on changes needed to our healthcare system, Ontario's doctors understand the enormous impact of the social determinants of health and climate change on health outcomes. We therefore are calling on governments to take immediate action on these issues. And Ontario can rebuild its healthcare system, and it has to rebuild our healthcare system, but it can't do it alone. Our population is growing and aging, and patients' needs are increasingly more complex. The cost of technology, innovation, and treatment is also growing. That's why the OMA strongly supports the call by Premier Ford and other premiers for the federal government to increase the Canada Health transfers to 35% of provincial territorial healthcare spending. Ontario has lost billions of dollars that could have otherwise been used to serve healthcare needs and other economic needs for everyone in Ontario, and even, of course, people of Ottawa. And so Ontario's COVID recovery plan must include a commitment to fundamentally strengthening and future-proofing our healthcare system. All of us are patients. All of our families and friends and colleagues and neighbors, they're patients. All of us will need the healthcare system to be there for us when we need it. And it's imperative that we start now to rebuild that system. Collectively, we have, of course, sacrificed so much, too much during COVID. And that must never happen again. And as community leaders, you have an immense power to help, and I urge you to join with us. Visit betterhealthcare.ca to learn more about our prescription for Ontario and help spread the word. Tell your MPPs and elected officials from all orders of government, including Mayor Watson, to tell party leaders and candidates, to tell anyone and everyone who can help move the needle on progress that you support our plan. But more importantly, this isn't about the OMA. This is not about a partisan effort. This is not about left, right, center, whatever. This is about the people of Ontario. This is about our families and their health care, and being able to make meaningful changes. It starts with one step, and we need to be able to do that collectively together. So with that, I'll conclude, and I'm happy to field any questions, Mayor.
Thank you, Dr. Kassam. We really appreciate your time and all those thoughts on that 5-point plan. There are several questions, and maybe I'll start by picking up on a couple of your points, Dr. Kassam.
Sure.
And the fax machine is an interesting example, right? That we know that fax machines, which of course were stopped being used 20 years ago, and I know you're just using that as one example, but it does occur to me, to your point, that it is an administrative burden, and if there are in fact thousands, if not tens of thousands, of healthcare workers across Ontario, then even saving an hour of administrative burden, think about what could be done. You indicated in your 5-point plan you're looking for technology investments. Is it really on the e-healthcare records?
Yeah, so when we think about what a 21st century healthcare system would look like, as far as what is the digital infrastructure that's needed to support that kind of care delivery, I think about 3 major areas. We take virtual and put it aside. That's obviously part of the care delivery service. There is, of course, hardware and software considerations there that would need investment. And so when you think about what that infrastructure looks like, when we normally think about bricks and mortar in hospitals, this is the digital infrastructure, the hardware, software, that matters in terms of investment, absolutely. But 3 other major areas are integration. And so this is sort of where faxes come into play. We have e-faxes, and people will now have technological advancements of faxes. So you can have an app that digitally sends you a fax. Part of the reason why faxes were so important was around this concept of privacy. And so data privacy of folks, so health information privacy. And so that's the second pillar. What do we do with privacy? How is the law evolving as we start migrating onto a digital sort of infrastructure? And this is where legislation, both at a federal and a provincial level, matter. And then the final area, so it's integration, we have privacy. And then the final area is actually security, data security. We're seeing what's happening around the world with cyber warfare. We've had issues in this province, in fact, amongst certain healthcare environments where our systems have been hacked. And that actually provides a significant challenge moving forward. So for example, I work at a hospital who's under a larger umbrella hospital network. In the summer of last year, our system was hacked. We had to go back to paper charts, paper orders, because our entire system was seized. This happened at a province-wide level in Newfoundland, I think about 3 or 4 months ago. Their entire system was seized. And so when we think about digital, we think about infrastructure. And as to your point, are we asking for funding for digital health? Absolutely, and in digital solutions and electronical sort of manifestations of integration, but also those other elements that have to come along with it that prevent us from being sitting ducks.
Yeah, it's a great point, and I do appreciate there's lots of privacy concerns. It just occurs to me, I'm sure to you as well, that we've solved some of those digital, or addressed at least some of those digital security concerns in many industries. Let's hope it can happen in healthcare. Dr. Kassam, we have a former counselor and a former local mayor, pre-amalgamation, Marianne Wilkinson, that was asking about family doctors, and I'm sure you get this question all the time. So Marianne is saying that about a third of new residents to the city of Ottawa are landing in Canada and they can't find a family doctor. Any comments for Marianne?
Yeah, this is a significant challenge. I'm married to a family doctor, and the shortage of first of all, we have a shortage of doctors. Okay, so that's pretty clear cut. We need to train more doctors. We don't have enough. If 1 million people in the province of Ontario don't have access to a family doctor, we're doing things a little bit backwards. And as we think about immigration, we think about aging, people are going to need more care, not less care. So number one, we have a doctor shortage. But to the point that's trying to be made in terms of how do you incent people to come and live and hang a shingle and sort of build roots here. I mean, you got to align incentive. So a very clear example of how this can be done is about 6 or 7 years ago, family doctors were prevented from joining what are called family health organizations or family health teams, which is a collaborative way to deliver healthcare, or at least primary healthcare. And that was an administrative decision that was made at the provincial government level. And what that essentially amounted to was the funneling of certain types of physicians, specifically primary care physicians, after residency, so after they've trained, into a different model of care that actually did not incent sort of comprehensive family medicine to take place. And so if we want to be, and we have been advocating for this as an organization for years now, we believe that that physicians should have the autonomy to set up the type of practice that they see best, or that they feel is best served for their communities, which includes the entry into these comprehensive capitated models. And that's what we've been advocating for. So we believe that returning to that model of care before, with slightly different parameters, would actually be very, very beneficial. And these are discussions that are happening both at a provincial and a federal level.
And you touched on earlier in your presentation on the incredible backlog that's been caused because of the focus on addressing COVID-19 in our hospitals. Any thoughts, Dr. Kassam, on how the backlog can be cleared for so many people?
Absolutely. So, when we think about backlog, we have to think about sort of different buckets of care that needs to be delivered. So obviously we think about primary care, psychiatric care, mental health care, all of these types of care. That's one bucket. And the second bucket is sort of screening care. So things like colonoscopies and mammograms, diagnostic care, MRI, CT scans. And then the third bucket of care is sort of the procedural and surgical care that needs to be provided. And so for the surgical and procedural care, that's one that gets most attention. I have to wait 3 years for a knee replacement, for example. And this is where we've come up with a solution, which is an integrated ambulatory center. Essentially what that means is there are now the advancements in surgical technology and procedural technology have advanced so far that you can now do a lot of same-day procedures. So we think about things like ENT, so ear, nose, and throat procedures, eye surgeries. There's even now, and there are very, very robust data to suggest that even same-day joint replacements, knee and hip replacements, and other kinds of other sort of orthopedic surgeries can actually be done same day. And we also have obviously things like skin cancer, plastic surgery, and others. Even endoscopies can be done same day safely, and people can actually go home, or they can actually be decanted to other environments. This would be very, very helpful. And the reason why this is important is, when we think about acute care hospitals, so in Ottawa, you think about the Ottawa Hospital or Ottawa Heart Institute, or, all these major centers, which do great work. I mean, they're fantastic. But it's hard to streamline efficiencies. It's hard to realize efficiencies in these environments for a number of reasons. If you have a center that was doing just hip or knee replacements, or a center that's just doing cataract, you can imagine that you'll realize those efficiencies and the throughput much, much better than a larger organization that has, let's say, 40 different operating rooms with 40 different types of procedures and so many different elements of that care that needs to provide the equipment, the different technology, so being able to streamline that efficiency by taking it out of the hospital, putting it in these integrated ambulatory centers would actually provide much better and much more cost-effective care. We've also found that this is jurisdictionally happening in other places around the world. Western Europe, the United States, Alberta, and Manitoba, they've realized efficiencies of 20 to 30% in terms of the numbers that can be accelerated through this kind of model. So when we think about how do we do that, that's one option. Now, obviously, that's going to have And I know this is a long-winded answer, but that's going to take some time to build, obviously. You don't just build things overnight. And so we do have existing capacity in our healthcare system that we need to be able to scale up. So extending operating room hours, funding those hours, and funding those healthcare human resources appropriately would actually help to get through the backlog as well.
And maybe finally, Dr. Kassam, we have a unique audience of business and community leaders watching today. I think some people can feel discouraged or frustrated that everybody realizes the provincial healthcare system needs to evolve, but we're not necessarily seeing a lot of evidence of that. I'm sure I'm missing all sorts of things when I say that. And I should point out that we're, on the precipice of officially announcing a giant new hospital for Ottawa. So that's certainly some progress. But what is your maybe call to action to the business leaders watching us here?
So I have two calls, I would say. The first is, of course, jurisdictionally, healthcare is administered provincially, and so this is how having healthcare on the ballot is going to make a lot of impact over the course of the next 3 months as we lead into an election. I think that's very clear. Political advocacy is very important. It also has to happen at multiple levels of government. Healthcare is a team sport, and so when you can't have more with less. And so this is why our call for federal healthcare transfers from the Canada Health Transfers to be increased at 35% of federal spending is crucial to being able to sustain our healthcare system. And then the second call to action would be to and this is where the business community and local sort of grassroots leadership is very, very helpful. We have to remember that 75% of care that's delivered across the province every single day happens outside the four walls of a hospital. The CapEx and the OpEx of a hospital and acute care is very, very high. And so how do you streamline that? How do you derive and deliver on cost savings by bringing a lot of these types of care provisions outside the hospital into more localized environments? And we're seeing that. We're seeing sort of a migration. It used to be, 100 years ago, care was delivered door to door to people, right? A doctor would take his or her bag and go door to door, and people and then shift that 30 or 50 years down the road, and no one goes home door to door anymore, and it's always in a clinic or in a hospital. We're shifting back. The pendulum is swinging back to the community, and this is where the business community, investment, innovation, technology can actually be leveraged in order to deliver better care more fastly, more timely, and with better patient satisfaction scores.
Well, some good points there, and with a provincial election coming up, hopefully your call will be heard. And I should point out that Suling Ching, who was on screen earlier, has made the point. Certainly, Dr. Vera Etches as well, about the connection between the economy and healthcare, never more obvious than during the pandemic. Dr. Kassam, thank you very much for joining us. We appreciate that you've got a very busy schedule, and on behalf of everyone watching, thank you for your service and the service of your tens of thousands of doctors working to secure our health across the province of Ontario. Thank you very much.
Thank you for the invitation. Thank you for everything that you guys are doing as well.
Take care. On behalf of Mayor Jim Watson, his council colleagues, and the Ottawa Business Journal, Ottawa Board of Trade, thank you to Dr. Kassam for spending some time with us this morning. To demonstrate our appreciation, a gift will be provided to Dr. Kassam from Eamon Harnden, our speaker gift sponsor for today. Eamon Harnden is doing very important work in supporting employers with management side employment and labor law advice these days. A few key updates from OBJ before we wrap up. This is kind of my show and tell segment. So since we last met, OBJ has launched a few publications that I just wanted to bring to your attention. Here's the first one. It's a very popular project we do. Big project, in fact. It's called the Ottawa Book of Lists. OBJ's research team worked for months surveying about 800 different businesses to create listings and categorize people and rank them. So as we say, even in this age of Google, the Book of Lists will tell you many things you cannot find online. So you can visit obj.ca/BOL, standing for Book of Lists. So obj.ca/BOL. Also, just on the street this week, the Beauma office space directory, something we've done for over 20 years. And again, seems kind of funny that I'm doing show and tell here on screen, but it's a directory of major commercial and industrial businesses in Ottawa and Gatineau that's just hitting the street. It's published in partnership with the Building Owners and Managers Association, a very active and vibrant business group in Ottawa that are real estate experts, of course. And you can now go to obj.ca website and scroll all the way down to the footer, and you'll see the digital editions. And I should point out, I was obviously holding up the physical editions, but they also exist in a digital format. So thanks to Beauma for working with us on this project once again. A couple notes from Ottawa business events. Very excited to say that the 40 under 40 nominations are now open. You can visit and go to 40under40.ca. You see that on screen. So it's FORTY under40.ca. This is a big milestone year. It's the 25th ever 40 under 40. So if you do the math, 25 times 40, it means we will recognize the 1,000th recipient of 40 under 40. That's a bit of a mind-blowing thing to think about. So once again, please go to 40 under 40. You can do so submit nominations till about the end of March. Also happening towards the end of March, specifically on Friday, March 25th, we have Vanessa Canoe, who is the CFO of TELUS International. Vanessa was recognized as our CFO of the year back at the Best Ottawa Business Awards. So she is speaking at the Mayor's Breakfast in person. Can you believe it? We're back in person at City Hall. Keep your fingers crossed. And you can go to Ottawa BOT.ca, ottawabot.ca. We've also confirmed on Thursday, April 14th, that General Wayne Iyer, Chief of Defense Staff, will be the Mayor's Breakfast speaker in April. So again, that's Thursday, April 14th. General Wayne Iyer, Chief of Defense Staff, again in person at City Hall and Jean Piggott Hall and Council Chambers. Can't wait to see you all there. Also, we wanted to point out a CEO Talk Luncheon. So yet another in-person event. This has to be a good sign for the local economy. We have CEO Talk happening on March 16th with Rami Bowers, who is the president and CEO of CMHC. That's happening at Brook Street Hotel out in Canada at 11:30 to 1:30 p.m. Again, all of these dates and events can be found at ottawabot.ca. Ms. Bowers will be talking about the housing situation and what it means, not only from an investment perspective, but more importantly, from an economic perspective, as we try to bring more people to Ottawa to fill all the vacant jobs we have. As we conclude, let's recognize the great sponsors that line up behind the Mayor's Breakfast. Our lead sponsor is Hydro Ottawa. Also, we have RBC, the Commissionaires Ottawa, Algonquin College, Rogers Communication, the Westin Ottawa, Enbridge, our global partner Oakwood Designers and Builders, our food sponsor La Cité. Looking forward to eating with everyone in March, that is, and April. Our speaker gift sponsor Eamon Harnden, and our coffee sponsor Capital Office Interiors and Steelcase. Thank you once again for joining us for this edition of the Mayor's Breakfast. We will see you in person in March. Bye-bye.